Headaches are quite common. At one time or the other, many of us had experienced it, and they could go from mild to being very severe, from being simple to being complicated. So today, let's talk about different kinds of headaches. But before we continue, you are welcome once again to this channel, Dr. Ayikes. I'm still Dr. Hayobola Ogumbanjo. Kindly subscribe, like, and share this video to be able to reach more people. So let's get to it. Like I mentioned, headaches could be simple and they could get complicated. And it often depends on the kinds of headache the person may be experiencing. There are a lot of different kinds of headache. We have the tension headache, the migraine headache, cluster headache, sinus headache, post-traumatic headache, to mention a few. But for the purpose of this video, we shall be talking about only 3 of this kind of headache: the migraine headache, the cluster headache, and the tension headache. Let's begin with cluster headaches. Cluster headaches are very painful. The name cluster headache comes from the fact that the headache occurs in clusters. That means you could have about 1 to 8 headaches at different times during the day. And each of these cluster of headache lasts for about 15 to 45 minutes, and it is very painful. It often typically occurs around one side of the eye, inside the eye or behind the eye. And you often notice that you could have stuffy nose or runny nose around the same side of the eye where you have the headache. For instance, if you have the cluster headache on your left eye, for instance, you could have your nose stuffed or running around that left eye too. And then there could be drooping of the eye around that same eye. And one of the things that you will notice with cluster headache is you get very teary. You have a lot of water coming out from the eye that is very painful, and the person is very restless and irritable around this time. Cluster headaches could last for months, and it occurs every single day. The person has the headache every single day. So after about maybe months, the headache had run, there's a period of remission. So the headache will subside for about 1 month or maybe few months, depending on how well you treat it. After that remission, the cluster headache will return again with a bout of pain around the eye, the stuffy nose around that place, the drooping of the eye, the restlessness, irritability, and all of that. Cluster headaches needs to get diagnosed and managed by your doctor. There are medications that could be used to lessen the severity of the pain that is felt, because it is quite a discomforting kind of headache. So now let's talk about tension headaches. Tension headaches are the more common kind of headaches. You feel the headache more on the both sides of your forehead. It comes with this dull pain on the both sides of your forehead. And sometimes it is infrequently seen in people, around maybe 2 or 3 times in a month. And for some people, it could be about 1 to 2 times a month. And sometimes it's often associated with lack of good sleep, skipping of meals, fatigue, or stress. More often than not, people take over the cancer medications for tension headaches and they get relieved. But sometimes it could get worse, and then you might need to see your doctors for proper diagnosis and better medications. And then lastly, we'll be talking about the migraine headaches. The migraine headaches are also very painful and debilitating. Migraine headaches typically occurs on one side of the head. Sometimes it begins from the eye, and then it goes to the head, and then to the back of the head on that one side. Migraine headache could last for hours to days, up to 48 hours if it is not well treated. So migraine headache could come with aura or without aura. When you have migraine with aura, it could come with neurological symptoms like numbness of your limbs or tingling sensations of your hands or feet, and some visual symptoms like halos, waves, flashing lights, or even temporary blindness. And then there's a migraine without aura that just occurs without any aura. But more often than not, there are warnings that precede migraine, like you could start feeling irritable, restless, depressed, or craving sugar, amongst other symptoms. And migraine could often be triggered by one of 2 things. You could have sensory triggers, like from the sense of smell, like you have strong smells from perfumes, deodorant, or from cooking oil. It could trigger migraine. Then you could have triggers from lights, like from bright light or sun rays. You could also have dietary triggers like skipping of meals, taking alcohol, taking caffeine, taking fried foods. Sometimes they could all trigger migraine. And another thing that could trigger migraine is stress, fatigue, poor sleep, amongst others. In all, when you notice any of this headache, it is better to visit your doctors for proper medical diagnosis and management so as to prevent complications. And for headaches like migraine or tension headaches that you could avoid, it is better to avoid the triggers. Make sure you sleep in time, avoid stress, avoid taking things like maybe alcohol or caffeine that could trigger the headache. Then avoid bright light, maybe you could wear sunglasses, amongst others. And if the headache persists, do not hesitate to see your doctors for proper medical diagnosis and management. So I'll be stopping here for now. Do not forget to subscribe, like, and share to reach more people. Till next time, Dr. Ayo truly cares about you. Bye.